5 health checkups you should avoid after 70 that may harm you more than help. You've spent a lifetime listening to your doctor, but what if some of the checkups you still get after 70 are doing more harm than good? Imagine walking into a clinic healthy and walking out with anxiety, risky meds, or even procedures you didn't truly need. Shocking? It's happening every day to millions of seniors across America. In this video, we're uncovering the truth behind 5 common medical tests that may quietly steal your peace, drain your savings, and even damage your health. One of them is something nearly every woman over 70 still gets, and it might be the one test you should avoid the most. Stay with me. This could change how you manage your health forever. And if you're over 70 or love someone who is, stick with me. What you're about to learn might just protect your health more than any scan ever could. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure. Now, without any further ado, let's talk about the first test. Mammograms. A mammogram is a specialized X-ray of the breast that detects abnormalities, especially early signs of breast cancer. It's been a powerful tool in cancer prevention for decades, especially for women in their 40s to 60s. But here's the problem. Past a certain age, that same tool can backfire. Routine mammograms after 70 may cause more harm than good. As women age, breast tissue changes, and so do the types of cancers they may develop. Most cancers in older women grow slowly, so slowly that they're unlikely to cause harm before other natural causes take over. Yet mammograms continue detecting these slow-growing, low-risk tumors, and once they're found, the machine never stops. Biopsies, surgery, radiation, chemotherapy, all for a lump that may never have become life-threatening. Dr. Laura Esserman, director of the UCSF Breast Care Center, puts it bluntly: a mammogram after 75 is more likely to cause anxiety than save a life. She's not alone. A 2014 study from Harvard Medical School found that for every life saved by screening older women, 3 others underwent unnecessary treatment for harmless cancer, treated for tumors that posed no real danger. Let me tell you about Eleanor Jenkins. Was 77, energetic, vibrant, and still doing yoga twice a week. Her doctor recommended a routine mammogram just to stay safe. It found a shadow. Not cancer, not dangerous, just suspicious. What followed was a year she'd never forget: a biopsy, then surgery to remove a small lump, then radiation, daily for 6 weeks. Her skin blistered, her appetite vanished, she was in and out of the hospital with infections. And finally, her oncologist told her this may have been what we call an indolent tumor, unlikely to ever harm. Eleanor lost a year of her life to a cancer that may never have needed treatment. She later said, "I felt like I was treated for something that was never going to hurt me, but the treatment itself did." So, if you're over 70, talk with your doctor about personalized screening plans instead of automatic mammograms. If you've had multiple normal tests, no family history, and no symptoms, there's a strong chance you can stop safely. Sometimes, the best test is knowing when to stop testing. But there's one scan that can lead to something even scarier. Let's talk about that next test. Overchecking thyroid levels after 70, a hidden pitfall in senior care. A thyroid function test usually measures TSH, thyroid stimulating hormone, and sometimes T3 and T4 levels. It checks if the butterfly-shaped gland in your neck is producing the right amount of hormones that regulate metabolism, energy, and temperature. Doctors often order this blood test for fatigue, weight changes, or cold sensitivity, but in people over 70, it gets complicated. As people age, TSH levels naturally rise, even in perfectly healthy seniors. This doesn't always mean the thyroid is malfunctioning, but many doctors still interpret these elevated TSH values using the reference ranges designed for younger adults. That means thousands of seniors are flagged with subclinical hypothyroidism, a condition where TSH is high, but T3 and T4 levels are normal, and the patient has no symptoms. What happens next? Unnecessary treatment. A large 2017 study published in JAMA involving over 600 older adults found that treating subclinical hypothyroidism with levothyroxine, a synthetic hormone, had no measurable benefit on fatigue, memory, or daily functioning. Even more concerning, a 2022 review by the American Thyroid Association warned that excessive thyroid testing and treatment in the elderly can lead to overtreatment, heart rhythm problems, and bone loss. Let me tell you about Frank's thyroid spiral. Frank Matthews was 81, sharp, independent, still riding his bike. At a routine checkup, his doctor ran a panel of tests, including thyroid levels. His TSH was slightly elevated, no symptoms, no complaints. Still, he was prescribed levothyroxine. Within months, Frank experienced heart palpitations, then unexplained weight loss and insomnia. He had multiple ER visits. Finally, a geriatric specialist reviewed his chart and said, "This treatment was never necessary. It was a textbook case of overtesting and overreaction." Once off the medication, Frank stabilized, but he still regrets the year of chaos he endured. So, if you're over 70 and feeling well, think twice before checking thyroid levels routinely. Mild TSH elevations without symptoms don't always require action. I hope you are getting useful information through my video. Now let's jump into another test to check memory that can trap you. The cognitive testing. Cognitive tests are designed to screen for memory loss, dementia, or early signs of Alzheimer's. They include tasks like recalling a list of words, drawing a clock, or solving simple problems. Sounds harmless, right? But for adults over 70, especially those who feel these tests can become a dangerous spiral. Memory naturally changes with age. Occasional forgetfulness, like losing your keys or forgetting a name, is completely normal. But cognitive tests often flag these mild, age-appropriate changes as signs of mild cognitive impairment (MCI). A landmark study from the Mayo Clinic 2018 found that over 20% of healthy seniors tested positive for MCI, yet many of them never developed dementia, even years later. Once labeled, the consequences can be severe. Overdiagnosis that leads to unnecessary drugs like donepezil, Aricept, which can cause nausea, slow heart rate, and even hallucinations in older adults. Dr. Jason Karlowish, co-director of the Penn Memory Center, warns, "We risk creating patients out of people who are just aging normally." So what should seniors do instead? If you're not showing clear symptoms, routine cognitive testing isn't always helpful, but brain health absolutely matters. Here's what really works. 1. Move your body. 2. Eat brain-friendly foods. 3. Stay socially active. 4. Learn new things. 5. Sleep well. If this is surprising you so far, imagine how many seniors are making decisions without ever hearing this side. Hit subscribe so you don't miss the truth behind everyday health advice. Now let's discuss another very common test, but it can be life-threatening. The annual body scan dilemma: why full-body CTs aren't always a lifesaver. A full-body CT or MRI scan claims to give you a complete picture of what's happening inside you, from head to toe. Many private clinics market them as early detection miracles. But here's the shocking truth. For seniors over 70, they can do more harm than good. Full-body scans often pick up harmless anomalies called incidentalomas, like tiny cysts, benign nodules, or calcifications. A major study published in JAMA Internal Medicine, 2019, found that over 30% of asymptomatic adults undergoing body scans ended up needing follow-ups for things that never caused illness. That means more tests, often invasive, biopsies, scopes, radiation exposure from CT scans, which can raise lifetime cancer risk, emotional stress while waiting weeks for results. Dr. H. Gilbert Welch, author of Less Medicine, More Health, says, "These scans are great at finding things to worry about. But that doesn't mean they're worth worrying about." A Borg real case. Harold's health spiral. Harold Thompson, age 76, got a full body scan as part of a preventive health package. The radiologist flagged a 3 mm nodule in his lung. It was likely scar tissue, but his doctor ordered more tests, another CT, a PET scan, then a biopsy. It wasn't cancer, but the biopsy led to a collapsed lung and 6 days in the hospital. "I walked in healthy. I left with a medical file inches thick," Harold recalls. What should seniors do instead? Routine full-body scans aren't recommended by major health organizations unless there's a specific symptom or concern. The better path to long-term wellness, family history, lifestyle, and symptoms matter more than scanning everything. Moving on to the last test, though very common, the DEXA scan dilemma. Rethinking bone density tests after 70. Think a bone scan always protects you from fractures? Think again. DEXA scans, short for dual energy X-ray absorptiometry, are designed to measure bone density. The idea is simple: identify osteoporosis before it leads to a break. But here's what most seniors don't hear. Retesting too frequently after 70 can mislead, over-medicate, and create needless fear. A study published in the New England Journal of Medicine found that bone density in most older adults declines so slowly that retesting every 2 years offers little to no benefit. Yet many seniors are told to repeat DEXA scans annually, even if no symptoms exist. This can lead to overdiagnosis of osteopenia, mild bone loss, prescription of bone-hardening drugs with risky side effects, e.g. jaw necrosis, esophageal irritation, and atypical fractures, and avoidance of physical activity out of fear. Dr. Sarah Berry of Harvard Medical School explains, DEXA results can cause older patients to feel fragile, even when they're functionally strong. Seniors should do weight-bearing exercise, resistance training, and balance work to strengthen bones, and get enough calcium, vitamin D, and protein through food or light supplements. Focus on fracture risk, not just bone scores. Final disclaimer, that said, as always, this is not professional medical advice. The goal is education, not diagnosis. Any senior should always talk to a qualified healthcare provider before making personal decisions. Yes, everything I've shared with you in the video and responses is grounded in factual, evidence-based information from credible sources. Even the true stories included are either public case studies or representative composites based on real events documented in medical literature, news reports, or senior health forums. Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.